Welcome to the Baby Bunting Live Series. This is Season 2, Episode 13. Tonight we are discussing postpartum recovery after the birth of your baby. With all of the attention and focus after the birth often going to the new baby, it's very important that mums are looking after themselves as well. We've invited Belinda Joyce to come along again tonight to answer our questions and as well as yours. Belinda is a midwife, maternal and child health nurse and author of Survive and Enjoy Your Baby. Thanks for joining us again tonight, Belinda. We're going to be covering all things postpartum recovery. So if you do have any questions throughout this episode, be sure to pop them into the comments box and we'll be answering them towards the end of the session. So Belinda, what can new mums expect in the first few days after birth?
Yeah, look, straight after having the baby, it's a period of time that you'll never have at any other time. You've got this beautiful new baby. You're also quite tired often from the labour and birth, regardless of the type of birth. And there's all this new information to learn, especially with your first one. Tonight we're going to touch on some of the more personal parts of recovery that you need to think about. And the reason we're talking about all of this is just so that you know when things are normal, what to expect. And of course, if anything's outside of that or you're concerned, always seek medical attention. So talk to your own doctor, your midwife or your maternal child health nurse, and just check that everything's going along okay.
Thanks, Belinda. Belinda, just to talk initially about pain after a vaginal birth and what mums might expect.
Sure. So after a normal vaginal birth, it's very normal to have some aches and pains, maybe a little bit of bruising, sometimes a bit of swelling. And if you've had stitches as well, then there's some associated discomfort there, which is really normal.
Mm-hmm. And often just the thought about passing urine, actually going to the toilet. Can you talk through that?
Look, most women get a little bit concerned about passing urine, and it can sting as well, especially if you have got a little bit of grazing or some stitches. So my best tip with that is actually sitting further forward on the toilet and actually directing the stream of urine away from the stitches or from the part that's sore. That can make an enormous difference, something so tiny. And then if it is still quite stingy, using something like Urine, which actually reduces the acidity of the urine and helps it not be so stingy to pass. Yeah. The other thing a lot of women worry about is using their bowels after giving birth, especially if it was a vaginal birth. And that's fair and it's a common concern, but most of the time it's actually fine. Keeping up your fibre and your fluids are really important. And if you are having trouble in that department, talking again to your midwife or your doctor and seeing if there's a medication that might help soften things and get that all moving before it becomes a bigger problem.
Okay, thanks, Belinda. Can you help us or explain to us what after pains are, and does every woman experience these?
Yeah, look, after pains are where the uterus is actually contracting down, and that's really important. By contracting down, it's actually reducing the size of the wound where the placenta was attached, and it reduces your bleeding, so it's really important. With a first baby, most women don't feel this happening, but with subsequent babies, it usually gets stronger and stronger, and then you may need some pain relief. Something like Panadol or ibuprofen, those sort of things will often be enough, and a heat pack can help as well, and it will settle gradually.
Okay. You spoke a little about stitches. How should mum be caring for her stitches?
Yeah, look, stitches really need to be kept clean and dry, patting them dry gently after showering, changing your pad fairly often so that it's not getting too moist, and also cold packs. So most hospitals will offer a disposable type cold packs that you can pop in your pad, and they work really well. But once you're home or even in the hospital, there are some really great reusable ice packs as well, like this body ice. This has a kit that's for the breast and the perineum, which is that part that sometimes has the stitches. So that can be a really helpful addition as well.
So it's a little like sports injuries, and I think they call it the RICE regime?
They do. So just like if you've had an injury with a sports injury, using that RICE regime. So rest, ice, compression and elevation. So obviously that's the ice. Rest and elevation are really lying down and getting the weight of your body off your pelvic floor and letting that muscle heal. And then compression is just firm fitting underwear and a pad is all you need to do there. And just those simple things can make a real difference.
And how can mum keep an eye on her healing and know that things are heading in the right direction?
Yeah. Look, I always suggest it's worth having a look with a small mirror and just checking the perineum every day. So checking where the stitches are and making sure that it's looking like it's healing, it's not getting red. Most people are a little bit nervous about doing that, but it is a good idea just to know what's going on with your body and that it is improving as well.
Okay. We also have a lot of mums that would have a Caesarean. So they've got stitches, and how would you recommend that they care for their wounds?
Sure. It's really similar. Again, the stitches are just at the bottom of the abdomen, and most women will need a little mirror to have a good look at those stitches too, so do that. Early on, it will have that wound will have quite a large dressing on it. So after a couple of days, that will usually come off, and they might even suggest that you take that off yourself, and it's easiest to do in the shower. And then sometimes there's some stitches to remove as well, and your midwife will usually do that, or a doctor. And lots of women get worried that that's going to be uncomfortable or a little bit scary, but I've removed many and it's never painful. It's quite an easy little procedure to have done.
Good.
And then it's just checking that wound every day again, looking for any swelling, any redness, anything like that. Most of the time they just heal beautifully.
Okay. Belinda, what about bleeding or Lockia after
Yes.
birth? Can you just explain that for us as well?
Sure. The Lockia is the blood loss that we have after the birth, and you'll probably hear the midwives and doctors talking about Lockia and think, what is that? It's just the blood loss, and it can be like a really heavy period for the first couple of days. And after going sort of 9 months without a period, it can be a little bit of a shock. And it's very normal though. So we're looking at, in those first couple of days, it's usually quite a bright red loss, and then gradually over a few days it should change to a darker brown or even a paler pink. It shouldn't stay that really bright fresh blood the whole way through. So your midwives and your doctors will be asking you about how that's going and the amount and that kind of thing.
And is there sort of, it's always a concern post-birth. If there was an excessive blood loss, how would mum know that?
Look, if there was a really excessive blood loss, you'd be changing your pad, say, more often than every 2 hours, or you'd have a profuse loss of blood. If it was a lot, you could always call 000. There's always the risk of a hemorrhage. But in most cases, just seeking some medical attention, if you think it's a little bit too much, would be enough. Okay. And you can always make that call as well and phone ahead to check what you should do.
And how long does the bleeding actually last?
That wound inside the uterus takes up to 6 weeks to heal, but you shouldn't be bleeding bright red blood for 6 weeks. So within a couple of weeks, it really should have settled a lot. And if it were to start up again, we would want you to seek medical attention. But it's normal just to have some discharge up to that 6 weeks, but it should gradually get paler and less.
Okay. And what advice would you have for mum's breasts in the first few days?
Yeah, look, regardless of whether you're choosing to breastfeed or not, everyone's breasts will start to make milk. It's their job, and most people only have one baby, but most people make enough milk for 4 babies. So we call it the milk coming in, and you can feel very full very quickly. So the milk usually comes in around sort of day 2 to day 7, and it can be quite an influx of milk.
Mm-hmm. Yeah. And if mum's breasts are very, very full, how best can she manage that?
Yeah, so feeding the baby fairly frequently, and luckily newborns tend to enjoy feeding fairly frequently, so removing that milk really helps. Also, you can express a little bit more for comfort. Using cold packs works really well, so you can use something like, again, those body ice packs that we talked about before. These can actually be used hot or cold, so there's other uses for them too. Cabbage leaves have been used for many years, and if you're going to use cabbage leaves, just make sure that they've been washed really well to get off any chemicals, and that you've had them in the fridge, and if there's any really large veins in them, just cut them out so that they're not pressing into the breast, because they can cause blockages, but they do work really well as well. Yeah, and just trying not to remove too much extra milk so that your breasts will get to know how much milk to make for your baby.
Okay. And could you explain to us what mastitis is?
Mastitis is it's an inflammation of the breast, and it can come on within hours. In some instances it's an infection, and you will need some medical help, sometimes even some antibiotics. But in many cases you can just really work hard at keeping the milk flowing to avoid that breast getting too full, and to try and unblock any blockages if there is a blockage. And that's where a heat pack could actually be quite good. So the cold pack can be good for comfort and to reduce swelling, but then the heat pack can actually help with getting the milk flowing as well. So if it's not going away and you're feeling very unwell, it can feel a lot like getting the flu, then you will need to talk to your doctor.
Okay. And if mum is not breastfeeding, are these the same strategies that she would use for her breasts as well as she's letting down?
If mum's not breastfeeding and their milk has come in, it's really important to try and suppress that milk making. So by not removing too much milk, cold packs work really well for comfort and to reduce the inflammation, but sometimes they will need to just do small expresses for comfort, just to stop the breasts getting engorged and too overfull. There are also medications that some people choose to use, but in most cases just not removing the milk is enough to signal to the breasts that they need to stop making the milk.
Okay. And if mum's nipples are sore, what's the best strategies there?
Look, in those early days, most women get fairly tender nipples, and babies, you know, sometimes they attach really well and other times they don't attach so well, and it only takes one feed where the baby's slipped off a little bit, especially overnight it seems to happen, and they cause a little bit of damage to the breast, or to the nipple. So it's really important to look after your nipples. So rubbing a little bit of your own breast milk into the nipple can work really well, as can a cream, something like Lancino works really well, so it's a purified lanolin. The benefit of that is you don't have to wash it off. It's safe for your baby to attach to the breast next time. Just putting a small amount, a really small amount, in between two fingers and rubbing it around is enough to sort of soften it up and warm it up so that you can apply it to the nipple without it really dragging the nipple and being quite uncomfortable. Yeah.
And are breast pads helpful as well?
Breast pads are, and there's some amazing hydrogel breast discs that you can keep in the fridge. They work really well with the nipple healing.
Yep.
And then the breast pads, there's lots of different brands, but the breast pads, there's disposable and washable and all sorts of different styles and shapes as well, so you will find one that fits you best. They just help with any leakage. Most women will leak some milk, especially in the early days when they've got that oversupply. And they also help smooth the breast and help to avoid that sort of nipple show through in your clothing too.
Okay. And so after the first few weeks with the body starting to heal, thoughts might start to turn towards getting back in shape and doing some exercise. How soon can this start, and what are recommendations around that?
Look, if you're comfortable from day one, really, you can do just some gentle walking. You don't have to be lying down in bed the whole time, although you do need to do some of that, as we've discussed. But some gentle walking is really good. If you're wanting to do anything more strenuous, it's really important to get a doctor's clearance if it's less than 6 weeks after having your baby, because we really don't want you doing big strenuous exercise when you've got that wound healing and all those other things going on, as well as probably some sleep deprivation and things.
Yeah, and I think we've got a product that we can also help with support and compression.
That's right. So there's a couple of different sort of styles there, but the Belly Bandit has got a couple of different supportive sort of devices there. So this one can be used during pregnancy as well as after, and they can just help, that comfort, but also giving some support and helping with the core, because after having a baby, everything changes, and this can be really helpful. And this one can be particularly good for shaping the body as well. Okay, so they're handy.
Shaping and getting the core sorted, and some pelvic floor exercises in that first 6 weeks.
Yes.
And what happens at the 6-week checkup for mum?
The 6-week checkup's really important. So it's either usually with your GP or perhaps an obstetrician or a midwife. And it's about looking at your whole recovery after the birth and how you're feeling. So the physical recovery, so talking about your stitches, also thinking about your emotional health as well, so how you're coping with new parenthood, a bit of an examination of baby, so top to toe examination of baby and another check of their hips, and also a chat about contraception too, if it wasn't already discussed in hospital, or even if it was, it's worth checking in on again at this point, depending on whether you're wanting to have another baby quite soon after.
Okay, so I guess that does lead to sort of other sensitive subjects, but many women worry about having sex after they've birthed their child. What advice can you give here?
Look, it is sort of something that most women are not feeling ready for in the early days or weeks, obviously, especially if they've had a more difficult birth. My suggestion would be waiting for that 6-week checkup and having a good chat with your doctor, talking about contraception as well, because occasionally we do have babies that are very close together because that hasn't really been thought of or discussed. And then also having a really, good chat with your partner and keeping your communication lines open, because chances are he's anxious as well about that, and then just taking things really slowly. Most women, may even want to wait a number of months before they're ready for that, and that's completely normal.
Okay. And then also mum's overall emotional health and her well-being towards that. What signs can mum look out for, or even can her partner be looking for with regards emotional health?
Yeah, emotional health's really important, and in those early days after having the baby, lots of women get what's called baby blues, and it's not to be mixed up with postnatal depression. It's a really common thing. Many more women will feel maybe a little bit teary, possibly a bit depressed or very anxious, and you might just ask them something and they burst into tears, and that's really, really common. But if it's going on for weeks and doesn't just go away, it's really important to have a chat to your GP, your maternal child health nurse, midwife, or there's some really great hotlines that you can call through Panda and Beyond Blue as well. Postnatal depression is a really common condition for so many people, and also for fathers. And we often forget that partners can also have these symptoms.
Okay, so Panda and Beyond Blue would be the recommendations for a starting point if it's not your medical professional.
Yes.
Yeah. And so many changes with postpartum, but another issue is actually hair loss. Is that normal?
Really normal. So a lot of women will actually gain more hair during the pregnancy, and after they've had their baby lose some extra hair. And it can be quite frightening finding, that you're brushing your hair and you've got large amounts of hair, a lot more than usual in your brush, up to around 6 months, and then it will usually settle. If it was excessive or you were concerned, again, talk to your doctor about that.
Belinda, thank you so much. Belinda, you've been so informative, and I'm sure you've helped many of our viewers tonight. We really appreciate you joining us again here on the live series. For those that would like some more information, you can see more about Belinda and some details of her book and the website just by following the link on our Facebook page. So please take special note that if you have any concerns about your baby's health or specific questions about any of the topics that we've covered tonight, we encourage that you do see your maternal and child health nurse, doctor, or any other appropriate health professional. So again, thank you all for joining us tonight, for watching, and we'll see you next week. Good night.